Yeah, tonight we are glad that to have Dr. Kan from Thailand, and actually just came back from UK. We just have a chat like if we are online yesterday, and he was in London. Yeah. So, but we are very honored to have Dr. Kan from Thailand to be with us tonight online to share his experience and insight about anthroposophic approach to medicine. And I believe this topic is very attractive, especially to the public who are concerned about, the health and well-being. Yeah, I would like to introduce a bit of the background of Dr. Kan. Dr. Kan graduated from Phramongkutklao College of Medicine and complete his master degree in anti-aging and regenerative medicine by Luang University in Thailand. So when he encountered anthroposophy and he realized that the importance of this medical approach is as a medicine for humanity, he then transformed his clinical practice by using the concept of anthroposophy medicine as the center of the practice. And Dr. Kan, the profile is so, I think I read it, the introduction is so long because he has a lot of training and certified with him. He is also a certified in Classical Homeopathy, Acupuncture, Naturopathy, and Spacial Dynamics. And now he currently teaches and lectures in Anthroposophic medical training in Thailand, Taiwan, Indonesia, Switzerland, and other medical training in different countries and as well as in Asia Pacific. Yeah, so I personally very looking forward to Dr. Kan sharing. Yeah, and now I would like to pass the floor to Dr. Kan. Over to you.
Thank you, Samantha, for giving me the opportunity to working with the teams. This is very nice. And thank you for all participants also to give you about your details, some interest that you have for anthroposophic medicine. I think this is something that is very helpful for me. You need a translation?
No, so it's English.
Oh, yes. English. Okay.
Yes.
It's very good.
Yeah.
And because of I look into the content, it's so difficult to condense something in just only half an hour. That's why I think that it would be good if I have some idea from you and I will start from this idea. It would be very good to start in this way. I also study many things in conventional world for many years. If I have to tell about myself, the first thing that I remember in the medical world is about to deal with the patient in the emergency unit and a lot of things in the conventional world. But I feel it's so horrible because I felt myself in a situation like a war all the times. But it's very difficult to say because I also graduate from the military medical school. That means I study medicine from the military. That means everything has to set up, everything has to be at the center. We have the satellite unit, and afterward we take care of the patient. We send back to the center. That means our main hospital. This is the medicine that, and we have always think that, okay, when we see the patient, what's happening to the patients, and after we have a diagnosis, after that we have the therapy. It's like arsenal of the weapons that we are going to deal with the disease. We can say something that in my experience in medicine, we try to naming the disease and we try blaming the symptom, and afterward we try to eliminate all the things with all the weapons that we have, that we call medicine. This is the experience that I have. And after I graduate from the medical school, the thing is they sent me into the military hospital. my main task is, okay, I take care for the intensive care unit. And also I have to practice to perform the surgery also. At here, I have a lot of things about surgery. The best thing that I can do to cut everything. If we have the problem, we just cut. I cut many legs, cut many hands in order to save the life of the patients. You can say that we don't have the way to save the organs or the body of the patient, but we have only thing is to save life by cutting everything. Like if you have a hands and you have the problem in your hand, when you cut your hand, the problem is gone. Or you have problem in your leg and you cut your leg, the problem is also gone. Until one day I think that I cannot live my life in this way because only therapy that I have is I damage the body. I thought for the whole night. In the morning, I decided to go to my boss and say that I would like to stop to practice to be a doctor because I cannot do anything like this anymore. And I think to myself that if this is the only way that I have to treat the patient like this, I should not be a doctor. After that morning, I stopped to be a doctor and then I returned home. I cannot practice and I cannot damage the body of the patient anymore in many things because I think that even the medicine you try to just only control the symptom, not think about healing at all. This is the reason why I stopped to be the physician because my heart cannot, it's not possible for me to practice. But it's very difficult because I try to discuss about this topic to many doctors, many physicians in my life. They say to me, I think too much. Because this is the only way that all the people that they accept around the world. This is the standard of therapy. That means the standard of the healing. That means you have to lose the organ. You have to take the drug always, all time, cannot stop because you want to control the disease. The patient cannot be free. Medical business is grow bigger and bigger because somebody have to pay all the time. That's we call the appointment. You see the doctor and then you have the next appointment, the next appointment. This is what's happening in medical world. When I work in the business, it's very good because I work in my family. But afterward, my family also has some problems. My sister, she is almost to graduate to be the medical doctor also. But during that time, she has a tumor in her brain. This about 17 years ago, I would say. But now she's still alive. She has a tumor in her brain and I don't know how to solve it because I just look what's happening in the medical world that I know. They have only the drug to control or chemotherapy to destroy the tumor in the brain. I have no choice. This is the origin that I thought that I should go to study many things in medicine because of I am a doctor. If I cannot study, who else can study? This is the origin that I started to travel around the world to study all kinds of complementary medicine that my friends and everybody say, is this not true? Is this not legal? Is this not standardized? But if this is the only way, if they have a news, only a glimpse that show that some patients can survive or getting better from this kind of therapy, I just go. I just want to learn. You know, I am not a person who like to share, who like to show how I know, but I prefer to ask the people and teach me and tell me how to work and how to do. for all the time. I study in naturopathy, I study in Chinese medicine, I study in homeopathy, Bach flowers. I study almost everything that is possible for me that I can travel around the world and I can study. During that time, my English is not so good. I always stay in Thailand. I never go out, and I cannot speak in English. I cannot understand so much in English. But this is about 20 years. Because only way that I can study many kind of things is I have to study in English first. English is some like a door for me in order to get into all kind of therapies. No, and after I study many things, yes, during that time, I found homeopathy is very nice and it saved the life of my sister, and tumor is shrink down, it's gone. It's just so powerful. Even I study, I treat just only some very few cases. I treat just only some people who stay around me, or my family, or my friends, or some people who would like some help from me. I just help them. I never put all the things that I study into the practice at all. And I don't know also why I have to practice. Because I found that, okay, this kind of thing, many people around the world, they also practice. And even I practice and I a little practice and work, something that during that moment I feel the arrogance. Because of the more I use this kind of medicine that I know more than others, I feel that I am like God because every people come to ask for my help. Okay, I can do, but I just do case by case. Some have success, some fails. Okay, is this normal in medicine? But I can say that sometimes it's quite boring for me because of, okay, some people, because at the end, even you treat with the homeopathy, the disease coming back again. That's why in medicine, in homeopathy, they have the concept of constitutional. That means the patients have this disease and we give some remedy. It's like some error and you give something to fix the bug in the body or the bugs in the soul, the error in the soul, and you give something to correct it. And afterward, the patient getting better for a while, and then patient come back again with the same thing, and you give something to correct this bug. You see, even homeopathy, I think in that time, okay, the human being is like a robot. Conventional medicine is like the way how to fix the hardware, and homeopathy is used how to fix the software. At the end, the human being cannot be free in the soul, in the body. That means it's just the same, but only one thing has the material, one thing doesn't have the material. And I saw this situation almost every day. Until I don't know why I have to leave. Because the situation the same, and I found that I have no meaning in my work, in my life. It's like something that you are wake up and you have to go to sleep. You are hungry and you eat, and then you have to be hungry again. I don't know why. Until the point that I think about and I plan about suicide myself because it's too boring for me, and I don't know why I have to run in this circle. Maybe something about the Buddhism that says this is the suffering that I have. I have to stay in this loop forever. Only the way of nirvana that I can get out from this loop. In another word, I can say that during that moment, I have no meaning in my life. I don't have the faith why I should grow the direction of my life, and I don't know what is the thing I should do, or something that I should say, that I hope that I have in my life. You know, you study many kind of medicine, and you cannot find the hope, you cannot find the faith, and you lost the connection with the world. You don't know how to love the other, how to love the world, because you know too much, until I am also feel like I am not a human. And I plan to die because I don't want to live. That is the first time, also the first moment that I encountered to anthroposophy. You know, I met anthroposophy in 2015. It's not so long ago. I met Michaela for the first time before I am going to suicide myself. I told her I plan to suicide myself, but I met her first. Because Michaela asked me, where are you going? I replied to her, I'm going to suicide myself. That's why we're starting to have our conversation. And I stay in the conference for the first time in Anthroposophic Medicine conference. That's mean we call IPMT in Thailand. For the first time, I listened for the whole week. On the last day, I have the feeling that all the things that I heard for the whole week for the first time is true. Or I am going to lose myself into one kind of the religious practice, into the some cult, some spiritual cult that it is not possible to be true. It's too good to be true. And I know nothing. Only thing that I experience is my heart is warm, and I experience that this is the medicine that have the human heart as a center. And you know, I still not believe, but I have nothing to do. Okay, if it is true, this is, I will try to understand it. And I try to clear all my work, and I say to Michaela that, okay, I will go to see you again, that you have the program in India. I will study more in India. And she replied to me in that moment, no, see, we let meet each other in Kuala Lumpur. She doesn't care what I say to her, but she just only said that just be there. And I said that I cannot be there. And she said that see you there. You understand, Michaela? Sometimes she has something and she just insists something, and you don't know what is going to happen. This is the time that, okay, I have opportunity to meet anthroposophy again in Kuala Lumpur, in IPMT, Malaysia. And afterward, I think it's possible to, it's worth for me to look in detail more and more. That's why I asked, is anthroposophic medicine has a course around the world where it is. This is the point that I I stop all my work and I just only travel around the world to join anthroposophic medicine, the course around the world, where it is in Switzerland, in Germany, in England, in Taiwan, also in Japan, in China, in, I think almost every place that I go in USA, because I am so curious if this medicine is true, because it's really difficult for me to believe. You know, I travel all around the world. I study in Classical Academy to be, that is the course for German, course for training anthroposophic physicians. This is the time I'm not only study in English, I have to study in German. more language come into my life. You know, I hate German and I don't like to speak German. I don't want to read in German, but anthroposophy bring me to German language. It's so crazy. And yes, I work in anthroposophy. I study in anthroposophy until I don't know, someday I turn to be the lecturers, I turn to be the trainers after 7 years pass. You know, in my experience, I always say to the people that I never want to study anthroposophic medicine at all. I am never expect, I don't want, but for my experience, this is the only medicine that I can call the medicine. Only in the medicine, anthroposophic medicine is the medicine that it should be everywhere around the world. And this is the reasons why I open my practice. I stopped to be a physician. I just study and curious. I think about 20 years after I graduate to study almost everything until I'm quite sure that this is the medicine that I would like to practice. I think one thing that all the physicians, I think every people have in their mind, because I asked many physicians, they have two groups of physicians. The first who feel nothing and so happy to control the patients, and the second is the person who guilty, who afraid to see the patient because they know that they cannot do anything. They just only treat the symptom, and by the time the patient cannot getting better, at the end they lose their patient because their patient die. I can say that from my experience to practice anthroposophic medicine, I never feel the guilty to work with my patient even once in my life, because we try to look the best how it's possible to work with the patient, not only the physical body, but also some bodies that is invisible for us, and also something that is in the context of life that has the destiny and the karma that deal with the illness. Many aspects of the whole being. I never have the patient who try to sue me at all. Even on the starting, they are curious, and I try to work with them step by step. I think our patient can perceive how we look to them, how we thought about them, how we feel about them, because we are the human. If you just look at the patient like a machine, the patient will perceive that you are going to treat them like a robot or something like that also. Or if you look them like an animal, they can feel that they are the animal for the physician also. They can perceive. That's why I would say that the human has a dignity, and also our patient also has a dignity also. Dignity to live, dignity to stay with the disease, dignity to die. We forget the dignity of the human being. Sometimes in the consultation room, many physicians, they have the busy works, and they think that this is the burden of their life. That is the way that they try to eliminate all the patient as much as possible, because they don't know how to do that also. You know, some physicians, they cannot remember the face of the patient, but they can remember the pathology, or they can remember the note of this patient and the medicine that they describe or prescribe, but they forgot all the patients. When we look into the patients, something that is so honor for me to look at the patient is we can see how the human being they're leading their life to all the difficulty, all the struggles, and then they try to heal themselves. They try to fight. They try to bargain, or they try to support themselves, all in all possible things that they can do. But at the end, they cannot solve their problem, and they're starting to have their disease. And now the disease not just only in the soul, in the life, but now it's condensed and sclerotic into the life of the patient. That's we call the physical disease. If we not understand the human and you just only understand the pathology as the end, that's why we have the word that we treat the symptoms. Because also conventional medicine cannot treat all things like this. They only treat the symptom or cut it out. It's end. And also, if you look at the human being, just only the physical being, you cannot understand how sacred of the human being is. As Rudolf Steiner, he also mentioned in the occult physiology all the possible things that is you cannot see. What you see is the physical body. And the physical body is also the phantom body that is not real. But it is something of the connection of the life, soul, and spirit. And all these forces, they are meeting here in the physical world. That's why we have our physical body. If you look into just only the normal medicine, you can see only the material. Anthroposophic medicine helps you to see something beyond, but not try to get you into the spiritual rush or try to give you the opportunity to be something over than the human being, or try to be the angel, or try to be the god, something like that. We try to study anthroposophic medicine that we call the spiritual science or spiritual medicine in order to understand the way how do we work in our practical life in the guidance of the spirit, not to fall into the spirit and try to fall yourself into the spiritual power. What I try to say is, if you have the spiritual power, and after that, this spiritual power can bring you to fly above the cloud about 10 centimeters high. This is also, people speak about the spiritual power in this way, do some things in the superhuman way. But, you know, if the knowledge of spiritual side, it has the way to use in this way, we call this way the way of egoism. But if the spiritual power that we know, and we use it in order to help the life of the human being better in this world, in the physical world, this should be the true spiritual works or the spiritual power. You know, there is a difference between the black magic and white magic. The black magic is something that you use for yourself to serve your egoism. But the white magic is not for yourself. We try to use this magic in order to help the life of the others. This is one of the important things. Like the power of anthroposophic remedies, Steiner, he spoke that many physicians, we have to sacrifice our will to heal all the spiritual forces in order to transform it into the remedy for the patient, for the will to be healed of the patient. many people that I met in my life, they come to anthroposophy or anthroposophic medicine because they want to be the greater physicians. One thing is very good. But the second thing is they try to be something for themselves. And afterward, they practice for themselves and they say that anthroposophic remedy, it doesn't work. It has to not work like that. Because Rudolf Steiner also say that the most important part of the power of remedy is the esoteric training. This is the way how we train ourselves, to be the anthroposophic physicians. That's why it's so difficult. That's why I start with the question why you want to be the anthroposophic physicians or interest to anthroposophic medicine. Because many people, they fall into the magic or the wonderful result of anthroposophic medicine. But how to create it, how to make it happen in the life of the patient, it's not so easy. Because the physician must have the will to heal. And the patient also has to understand the condition and has the will to be healed. This is our secret, Because we cannot heal the patient against the destiny or karma. Only thing that we can do is how the karma and destiny allow you to work with the patient and allow the condition to be healed can be happen. This is some secret or something. If it's possible and you come to Malaysia for our conference, I would like to speak about something in the basics for you to look to the human being. And the conference is not long enough that I can see and I can speak with all the way to understand how do I work. But it is I try to bring the good start for you or some therapists or physician who never experienced to anthroposophic medicine. I try to give the basic thing for you to start. Anthroposophic medicine is every people try to encourage you to read and to work. And I would like to say to you that it's not possible. And please don't do that because you will lose yourself and you will get more confused. Because in the esoteric part, the way that you can start in a good way, that means you must have the teacher to guide you how to go. As I have Rudolf Steiner, Michaela, or Daphne von Bock also. She also my great teachers. And I have many great teachers who try to guide me in the right way. I can say that I can go far in this part, not because of myself, not because only of myself, but I have many good teachers who give me the opportunity. That's why when Gongsu Academy asked me about how to work in Malaysia, I said that if possible, I would like to work because I would like to return something that I received from all your works. I think maybe about 9 years ago that I start to study anthroposophy. When I certified to be anthroposophic physicians, the leader of medical session asked me why I want to be the anthroposophic physician. I say that I want to return. That's why I want to be. I don't want to be just only for myself, but I want to do something. I want to help the people. Because of the force of healing is not start from the center. The force of healing is always start from the periphery as the etheric forces. If it is start from me, it cannot be happen. But if it start from you and start from the patient, every possible thing can be happen also. I think I may answer all your questions, almost all the questions that you have in the box. But only thing that I don't yet have the fully answer is about the homeopathy and anthroposophic medicine. Only thing is homeopathy is something is very good, but only the things that I don't want to practice is they don't have the concept of the human being in the center. They have the concept of action, reaction, and the human being cannot be free. When we treat the patient, we have to respect what is the truth in their body, because what happened in the physical body is always true. What is the beauty in the emotion or the positive side in the emotion of the patients? What is the good thing that happened in the condition of their body in the disease that we can work? And afterward, we have to look how the individuality of the patients. And afterward, we can look how the life is going on, how is the direction of thinking and thought of the patient is going into the future, and how the patient is connect with the world, and how the patient transform his essence into something for the future, or the seed for the world that we call the hope. You know, this is the essence of the human being. No animal have hope. No animal has love. No animal has truth. No animal say that it is good because it's just only instinct. This is the forces just only for the human being. When we work in anthroposophic medicine, we know that our life of the human is so short. That's why the essence of the human being is something that we have to respect. We have to work with them. Homeopathy cannot work in this. Homeopathy can show something in the etheric body or the ether world. That's why the homeopathy is very good for healings, but not good for the life and soul and spirit of the patient to go into the future in the evolution and transformation to the next state of the human being. Because the way of homeopathy, they will bring the patient back to something before it's happened. That's why they have to repeat again as a constitutional remedy. You see? That's why I decided not to practice homeopathy because of this. Even I got the license to be homeopath from UK. But it doesn't mean homeopathy is bad thing. It's good thing for the healing also. But when you know something better for go to the next step, you have to reconsider how far you want to help the human being. I think I should end here and give the opportunity for you to have the breathe out to have some questions. Is it okay, Samantha?
Yeah, sure.
Yeah.
I think, yeah, I open this, to the floor. Yeah, to those who would like to ask Dr. Kan any questions, or maybe you would like to clarify about the sharing. You can just either you mute yourself, raise a hand, and the icon, the reaction, raise, and then or you unmute yourself and just pick up your question. Any questions from the floor? Yeah, there's one from June. They say, what's your view on a bug flower remedy?
Okay, with the bug flower remedies, if you notice the way of how to deal with the flowers is the process of how the life and the soul they are meeting with each other. This is the phenomena of the flowers. In the concept of anthroposophic medicine, in the soul of the human being, where's the point that life and soul they are meeting each other, we call the sentient soul. That's why wax flower is work for the therapy of the sentient soul. And also in the process of wax flower, they use the process as try to reflections. You see, only the remedy is not the key to solve everything. In the process of wax flower, they try to let the patient to understand themselves. That means they need another process, not depends on the remedy. They need the process of the human to wake up the spirit. But you know, the human being is not just only something that we can say that this is a 7 and many times up as in the concept of bug. It's possible for the soul, but not possible for the spirit. The bug flower is good for healing the emotion. But when you use for a long time, you're starting to get addicted because of your astral body or your soul starting to know what is happening. If you have no guidance from the spirit, it's not easy to lead the patient into the development. That means if you say that the concept of bug, they miss the concept of the individuality. That means the concept of the human spirit. If you read into the book for Dr. Edward Buck that he wrote the book names Heal Thyself, he has the concept of the your personality in this life and the contradiction between the higher self or the dictate of the soul. He used this word. That's why you have the healing. I do have the disease. But in anthroposophic medicine, we say that the disease is a gift from the spirit. It's not you do something wrong, but it's show you the spiritual part, how you go further. That means the way to look is different. But you know one thing about Dr. Edward Bach by himself, he also the anthroposophist. He ride a bicycle to Donut every year to listen to Rudolf Steiner. And his house and Rudolf Steiner house in London, just only one block, they are neighbors. If you read in, if you went to the, if you can go to the room of Dr. Edward Bach, he wrote many poets like our anthroposophists. Okay. Another questions about recommended books for anthroposophic medicine. No, I cannot read.
Oh, is it okay, he would like to ask doctor whether you can recommend a good book on anthroposophic medicine for a homeopath like him or her to have an understanding of anthroposophic medicine.
No. Because of, you know, if you are the conventional doctors, I will recommend. But for homeopath, I will not recommend because of the way of thinking. Sometimes it's too dangerous to understand anthroposophic medicine. In another word, you need a teacher who guide you for the first step until the time that you can read by yourself. You got me? Because of the concept of homeopathy is quite in the early stage. It's very hard to grasp down into the consolidate. And when you read something like this, it will go more and more. If possible, you should go to see some teachers who can guide you or some people who have the experience and you join with the group activity and learn from the real human being. Learn from the community. This is a good book for you. It's clear for me. It's clear for me. It's clear.
Are you okay, CK? Let's see another message. Yes, great, thank you, doctor. Okay, then we'll have two last questions. What is from iPhone?
Yeah.
We couldn't know his name. Yeah. Can you see the message?
Yes, I see the message. And I would say that the way you say that integration is something. Because most of people around the world think in this way, and the way in between is some intoxicated. Something that you think you want to in between and all the people and think all the people have the good thing. This is something that sometimes we may think that it is the something not in the good way, but most of the people think this is good because they don't want to have the contradiction. You know, we cannot heal the patient with hatred. You think that when we have the people who hate somebody and people who love somebody, the love and the hate can stay together as an integration or not? Have you ever seen somebody has the hate and love and integration? Why I say like this? In the beginning, I said that the way of conventional medicine is the therapy from the preparation for the war. In conventional medicine, they hate everything. They hate the microbes. They have antibiotics. They hate the pain. They have painkillers. They kill everything. They hate everything. They want to destroy everything. That's mean the way of allopath. In order to use the conventional medicine like the way of surgery, you want to cut the disease, you cut the leg off. But the way of anthroposophic medicine, we not cut the leg off, we try to save the legs. And the people who think that the cutting is good and the people who think that you have a leg is good is have a different way of thinking. You know, in anthroposophic medicine, you must to love your patient. And the patient must love their disease. You know, in Bible also, you have to love your enemies. What is the enemy? The enemy that in your life, or the enemy is something that try to prevent you from your goal that you have in your life, that we call the disease. In conventional medicine, we treat the patient and we naming the symptom and we blame the disease. We try to give the idea for the patient that the disease is something that not belong to you and you must eliminate it. That's why in conventional medicine, they train the patient to hate the disease. But in anthroposophic medicine, we train the patient to love the disease. The conventional medicine has a place in the way of medicine that is in the critical condition. I think that if they have the car accident, conventional medicine is the best. If you have the car accident and you give the anthroposophic remedy to have the healing, you will die. You know, you must put the good thing into the right place. That means the place for conventional medicine is the place that you want to save life. But conventional medicine is really bad in healing because the way of thinking they try to destroy and they bring with the hatred. But in healings, we need the love in order to heal. You know, if you have the will and you have love and you have the power and come to your life, if you have the will, you may have will, but you lost love, you lost power. Or you have the power, you will lose will and love. But when you have love, it's also possible to starting from something from the zero or even negative into something that is possible into life. Everything can be created, everything can be built if you have love in your concept of life. That's why in the way of therapy, love can create almost everything. That's why in the center of anthroposophic medicine, I always say that you cannot find anthroposophic medicine in Germany, in Switzerland, or anywhere in the world. You only find when the heart of physician love their patients. And you can practice it everywhere in the world. I think I answer your questions.
Thank you, doctors, for your heartfelt sharing. Yeah, we can feel the journey you go through. Keep continuing. And during your sharing, what I personally covers is your mention about the love in healing. That's the best medicine. Yeah. Of course, another keyword I take is about only, they put the right things for the right place. Yeah, I think this is, we need to have a very clarity mind, like you answer the questions of one of the participants mentioned. There's two extremists, but none of it is for all or none. You have to, bridging and how we integrate instead of it's become a conflict thing, but how we close the gap and make the things good, not for personally, is for others. Yeah, this is I believe from the sharing what I picked for the harvest today. Yeah. So of course I think there's few many questions, which one of the questions also for myself, but you can answer me later. Yeah. So well, all friends, if you'd like to meet Dr. Kan,
Yeah.
please join us the conference June 26th. Share the screen, a quick one. If you are not registered yet or you haven't decided, what to choose, I think do select. I mean, tonight's the workshop facilitated by Dr. Kan is one of the workshop. If you are in this journey or healing or any practice about health and wellness, this is a very good session that you can open up our insight and explore and go in deep. What about the healing and what's the difference with rescue the health? I do believe that Dr. Kan will share more about this fundamental. Yeah, so there are more 10 workshops for you to choose. Yeah, on for this coming conference, as well as we have 13 other practices. Yeah. So for the workshop is more on theoretical fundamental knowledge, and for the workshop is something brief out is for your is for more on practical. Yes. So for the details that about the workshop, kindly join us and stay tuned to follow our social medias and the group message where we will have the introduction of each workshop from time to time in English and Mandarin. So tonight I won't share due to the time constraint, so I won't be able to share each workshop in details. And I would like to share everyone do join this conference to meet all these tutors around the world, including Dr. Kan. Yeah, Dr. Kan, thank you so much for your time, and I appreciate that. And I think we really need a good rest for today after a long haul traveling. Yeah, and I will see you in June. And do keep in touch. Yeah. If you have any question, just you can contact me anytime.
Yeah.
Yeah. Thank you so
Okay.
much, and thank you for all the friends to join us tonight. And have a good weekend. So for detail that would like to find out, do connect with our team. Yeah, I'm Samantha from Kongsi and we have others team members, Chen Yi, Cherry, Kelly, and everyone or people surrounding you. Then do let us know if you like to find out more about the workshop and the conferences. Thank you once again. Thank you, Dr. Kan, and thank you everyone so much. And have a nice Sunday night. Good night.